Hi, everyone. A very good evening to all of you, and welcome to another session of NEET Bytes by Meritnation. And again, this is your NEET Byte session of biology as usual, and we are doing the next unit of biology right now, and we are going to talk about your next chapter of next unit, and the next chapter or the next unit that we are covering up today is biology in human welfare, right? Hello, Aditya. Good evening. So, biology in human welfare is the next unit that we are covering up today. And the first chapter of the next unit is related to health and diseases. Hello, Abhishek. Good evening. So, we will talk about few short questions or few MCQs related to this chapter. So, it's a quick way of revision for all of us. Pretty swift, pretty easy. So, welcome all of you to another session of Need Bytes. And today, in this chapter, definitely we are going to talk about the common diseases in humans, what is immunity, AIDS, cancer, drug, and alcohol abuse. Right? So, these are the topics of our today's discussion. Hello, Nisha. A very good evening to you again. Okay. So, I guess everyone is ready. Hello, Bhanushri. So, people are coming up, but a little slow. Anyways, it's good to see you guys here. And let us move ahead. I hope everyone is ready for the first question of the day. So shall we move ahead? I guess yes. Okay. So the first question is malt constitutes about dash percent of the lymphoid tissue in human body. Hello Meghna. Good evening. Akash, a very good evening to you. Keshav, a very good evening. Lucky Yadav, that's a nice name. Good evening, dear. And Shreya, okay. So Aditya says it is C, and Shreya says it is A. Harsh says it is C. What about others? So here is the first question in front of you. And what do we mean by the malt here, by the way? Muskan says it is C, and malt over here refers to mucosa associated lymphoid tissue. And this mucosa associated lymphoid tissue is present in my gastrointestinal cavity. It lines my nasopharynx, right, my trachea, and many other mucosa membranes of my internal tubes. So it is mucosa associated lymphoid tissue, and it constitutes 50% of the lymphoid tissue in human body. Hello, Kalpana. Good evening. So the correct answer over here is option A. Mustafa, the correct answer is option A here. Yes, mucosa associated lymphoid tissue constitutes 50% of the lymphoid tissue in the human body. Okay, so let's move ahead and let's see the next question of the day. So, asthma may be contributed to allergic reaction of the mast cells in the lungs, or inflammation of the trachea, or accumulation of fluid in the lungs, or bacterial infection of the lungs. So, what is going to be the answer over here? And Meghna and Aditya says it is option A. What about others? Shreya says it is A. Payal says it is A. Muskan says it is A. What about others? Bhanu says it is C. Okay. Sudarshan says it is option B. Aarti, what is 70 over here? I'm not able to get it. Welcome to the class. Keshav says it is A. Abhishek says it is A. All right. I guess everyone is ready with their replies. What about, okay, Lucky says A. Kalpana says it is A. What about Nisha? Okay. So, asthma may be contributed to. The correct answer is allergic reaction of the mast cells in the lungs, which ultimately leads to the constriction of your airways in the lungs, right? And also secretion of large amounts of mucus. So, inflammation of the trachea or the constriction of the airways occurs as a result of the allergic reaction or allergic response of the mast cells in the lungs in case of asthma, which leads to constriction of the airways as well as huge secretion of mucus, leading to wheezing and difficulty in breathing. Yes, Aarti, the answer is option A. Let's see the next one. The next question is antivenom injection contains preformed antibodies, while polio drops that are administered into the body contains what? Is it harvested antibodies, gamma globulins, attenuated pathogens, or activated pathogens? So, this is a very common answer or a very simple question over here. And Shreya says it is option C. So does Meghna. So did Aditya. And Muskan said it is C. Payal says C. Sudarshan says it is C. Okay, Manish also is telling me it is option C. Akash says it is option A. Yes, weakened pathogens are used in most of the cases where we are administering a vaccine. So, in case of a polio vaccine, also it is attenuated or weakened pathogens, right? So, the correct answer is option C, Nisha and Kalpana. I hope that is clear to everyone. And Keshav, the correct answer is option C here. It is not harvested antibodies, neither gamma globulins, which is again the same name or a different name for antibodies. Okay, let's see the next question. So, all these things are pretty simple. Oh, Abhishek, no issues, no issues. So, which of the following set of diseases is caused by bacteria? Is it cholera and tetanus, typhoid and smallpox, tetanus and mumps, or herpes and influenza? Okay, Aarti says it is option A. All right, Abhishek, that's fine. At least you're attempting. I am happy to know that. Sudarshan says it is option A. Manish says it is option A. What about Nisha and Kalpana? Cholera and tetanus. Okay, Shreya says it is A. Yes. The correct answer is option A in this case. Cholera is a bacterial, is caused by a bacteria, so is tetanus. What about typhoid? Again, a bacterial disorder. Smallpox is a viral one. Right? Tetanus is a bacterial. Mumps is a viral disorder. Rashi, yes. Answer A is correct. Kalpana and Rashi. Herpes and influenza are viral. Right? So they are caused by virus. So over here, the correct answer is option A. So this is a simple question. Yes, smallpox is caused by a virus. Right. And now it is no more there on planet Earth. Okay. So, which of the following diseases is caused by a protozoan? Is it syphilis, influenza, babesiosis, or blastomycosis? So, what is the causative organism for this STD, syphilis? Anyone? What is the causative organism for this STD, syphilis? Okay, Nisha says it is option B. Influenza is a viral disorder. Lucky says it is option C. Okay, this looks like a tough choice for so many of us. We have learned about the causative agent of syphilis. Ye- okay, okay, not Treponema pallidum. Okay, so syphilis is an STD, right? And it is not definitely caused by a protozoan. Influenza is caused by a virus. We know that pretty well, right? Babesiosis is caused by a protozoan, Babesia, right? And it is just a malaria like disease which spreads with the bite of the tick, right? And blastomycosis, the name itself is giving me a hint. Myco, related to a fungus. So this is a disorder caused by fungus. So it's a fungal disorder. So the correct answer over here is option C. Yes. Bite of a tick, right? And it is pretty much prevalent in Europe and American continent, but not in Asia. Okay. I hope this is clear. We can move ahead. So here the correct answer is option C. All right, Anger Ahmed. And let's see the next question. Which of the following immunoglobulins does constitute the largest percentage in human milk? Is it well all rounder? We are going through quick, neat bite sessions of biology by Meritnation. And this is for those students who are going to appear for NEET examination. And here, many of you have given me the right answer. And the right answer is IgA. Immunoglobulin A is maximum in the blood. Yes, Madhusmita. So the correct answer is option C here. Nisha, it is option C. Dhanalakshmi, it is option C. That's a nice name you have got. Quick Chef Huda Usman. My God, Usmani. Okay, so I hope everyone got this. Okay, you are a PCM student. Okay, no issues. Welcome to the class. So, this is a journal science topic, and let us see the answer for the next question. At which stage of the HIV infection does one usually show symptoms of AIDS? So, remember, as soon as one contracts the HIV infection, they will not show the symptoms of AIDS. The symptoms of AIDS will start appearing slowly. So, what is going to be the correct answer over here? I guess many of you know it and you have given it to me, Anu. Hi. And the answer is definitely option C. When HIV damages large number of helper T lymphocytes, the symptoms of AIDS are visible. A human being starts getting various sort of secondary infections because the immunity is down. Yes, Meghna, that's the right answer. Akash, yes. Right. So that is the right answer, Nisha and Kalpana. Okay, yes, Dhanun. C is the right option. Okay, let's move ahead and let's see the next question that we have. So, infection of Ascaris usually occurs by drinking water containing eggs of Ascaris or eating imperfectly cooked pork, or is it caused by the tsetse fly or due to a mosquito bite? Well. That is slow, that is fine, Abhishek. Refresh once. And the correct answer over here is option A, Arthi. Yes, Bhanu. And Aryan, you are correct. It is option A. So, drinking water containing eggs of Ascaris. So, contaminated food and water is the causative agent for the disease caused by Ascaris. So, we are ingesting the eggs of Ascaris. Eating imperfectly cooked pork will result in tapeworm infection. Okay, I hope this is clear. We can move ahead. So, here the correct answer is option A. And the next question is, this is a very common one, Vidal test. Welcome to the class, Sushma. I'm so happy to have you here. Welcome. Let's try answering few questions that we have here. So, Vidal test is carried out to test malaria, diabetes mellitus, HIV/AIDS infection, or typhoid fever. Okay, looks like everyone knows the answer to this one. And so, what is the answer? Durga Prasad says it is option B. Dhanalakshmi says it is option D. And Muskan said it is option D. Sushma says it is D. Yes, you all are correct. The correct answer is option D. So in Vidal test, we are subjecting the individual to the antigens of typhoid, right? And it will cause the antibodies in the blood to get accumulated at a place where there are in and where the antigens have been injected, right? And it will cause a slight swelling over there. So this is one of the very classical and traditional tests. Almost a century old. Yes, Kalpana, option D is correct. Okay, let's see the next question that we have over here. And the next question says, in which one of the following options the two examples are correctly matched with their particular type of immunity? Thank you, Shreya. So, is it option A, which is correctly matched with the particular type of immunity? Is it option B? Is it option C or option D? So, this is a very interesting question. And polymorphonuclear leukocytes and monocytes, polymorphonuclear leukocytes can be termed as PMN leukocytes, right? Okay, so I'm getting all sort of weird answers. And of course, many of you are giving me the right choice or are opting for the right choice. That is good. Angar, a nice guess. Madhusmita, a nice guess. Yes, Shriya Narayanan. So, PMN are your neutrophils, right? A type of granulocytes. And PMN and monocytes are basically meant to phagocytize cells, right? Or phagocytize infectious agents. So, they are the main contributors for cellular immunity, right? So they are the cellular barriers that we have. And monocytes are pretty quickly going to get matured into macrophages, right? And macrophages are phagocytic cells just like your neutrophils, which are also termed as polymorphonuclear leukocytes, right? So that is the answer over here. The option A is correct. Anti-tetanus and anti-snake bite injections are passive immunity, dear. It is not active immunity. You are already injecting the antibodies into the individual, right? The antibodies are not being generated by the individual in vivo. So, saliva in mouth and tears in eyes is an example of physiological barrier, right? Saliva in my mouth and tears in my eyes contains an enzyme lysozyme, which is capable of breaking down the peptidoglycan cell wall of bacteria, right? So it is a physiological barrier, and the mucus coating of epithelium lining the urinogenital tract and the HCl in the stomach is a physical barrier. So that's the way to answer it. Okay, I hope this is clear. D is a chemical barrier. C, mucus coating or mucus lining in the urinogenital tract. You can say, okay, as a chemical barrier also, or a physical barrier. Okay, let's see the next question that we have over here. Select the correct statement from the ones given below. Barbiturates, when given to criminals, make them tell the truth. Morphine is often given to persons who have undergone surgery as a painkiller. So, chewing tobacco lowers blood pressure and heart rate. Cocaine is given to patients after surgery as it stimulates recovery. So, what is the correct option over here? I want all of you to reply quickly. Quick shift. Yes, the correct answer is option B. Chandana. Right. Option B is the right answer over here. So, morphine is often given to persons who have undergone surgery and it is used as a painkiller. Right. In very low doses. Absolutely correct. Right, Bhupesh. So, option B is correct. And morphine is derived from what? Yes, Kalpana, option B is correct. Morphine is derived from what? I hope all of you know that. So, anyways, let's move to the next question. We'll talk about morphine maybe a bit later. So, the letter T in T lymphocytes refer to what? Does it refer to thyroid, thalamus, tonsils, or thymus? Okay, Shriya, that's wonderful answer that you have given me. Yes, and the correct answer is option D, thymus. We all know T lymphocytes mature up in thymus only. That's why we use the word T over there. Right, right. That's the correct answer. Absolutely right. So all of us know the correct answer in this case. Okay. Yes, Nisha. Option D is right. And let's see the next one. So, use of antihistamines and steroids give a quick relief from allergy, nausea, cough, or headache. So, what is going to be the correct answer over here? And looks like everyone is telling me the right option. And the right answer is option A, antihistamines. Basically, those chemicals which counteract histamines, which are released by the mast cells, right? And antihistamines prevent allergy. So, the histamine released by the mast cells is a cause of allergy or hypersensitive immune response in technical terms, right? And in order to prevent it, we very often end up using antihistamines and steroids. All right, yes, the correct answer is option A, Kalpana. And let us see the next question. Steroids are also meant to depress the activity of mast cell Shreya. Okay, hybridoma cells are what? A product of spore formation in bacteria, hybrid cells resulting from myeloma cells. Why? Well, steroids are basically going into the mast cells and causing a modification in the expression of the cellular genes, and thus it prevents the release of histamine from the mast cells and reduces allergic responses. Okay. Nervous cells of frog or only cells having oncogenes. And the correct answer over here, Nirupma, you are absolutely right. It is hybrid cells resulting from myeloma cells. So, myeloma cells are your cancerous B cells, right? So, what kind of B cells? Basically, plasma cells. In B cells, those cells which are actively releasing antibodies into my bloodstream are termed as plasma cells. So, cancerous plasma cells are termed as myeloma cells, and they can be hybridized with the normal cell to form a hybridoma. So, the correct answer over here is option B. And let's see the next question that we have over here. And the next question talks about botulism caused by Clostridium botulinum affects the spleen, the intestine, the lymph glands, or the neuromuscular junction. Yes, Sudarshan, that's a wonderful way to recall it. Okay, we have four options here. Remember, Clostridium botulinum is a fungus and looks like Bhupesh has given me the correct answer first. That's wonderful, Bhupesh. So, Nisha, the correct answer is option D. Right. Kalpana, the correct answer is option D. Bhanu, it is option D. So, neuromuscular junction. See, Clostridium botulinum releases a toxin, and that toxin inactivates the neuromuscular junction, especially of many skeletal muscles. So, Bushra, the answer is option D here. Yes, Parul. Tushar, it is option D. So, I hope all of us will remember that. Yes, yes, Ritik. You know it. Botulinum. Okay. What are the symptoms, sir? See, it will deactivate my neuromuscular junction, right? And as a result, there is tetany, or you can say there is, what do we say? A person will not be able to move their skeletal muscles, right? Okay. Yes. So, which of the following is an opiate narcotic? Is it barbiturates? Is it morphine? Is it amphetamines or LSD? So remember, many of the drugs which are abused, yes, it may lead to spasms also. Okay, so many of you know the answer. That's good. Seth, yes. The answer over here is option B. Morphine, which is derived from the tears of the opium poppy, right, is actually an opiate narcotic. What do we mean by opiate narcotic, by the way? Can any one of you tell me? Those compounds which activate my Kalpana, the answer is option B. Those compounds which activate or which interacts with the opiate receptors of my cells are termed as opiate narcotics, right? Morphine is a pain medication of the opiate family, which is found naturally in a number of plants and animals. Right, absolutely correct. Yes, opiate receptors, not opium receptors. All right, let's see. Okay, I guess that is it for the day. So it was a wonderful, crisp, and short session. See you all again this Friday at this coming Monday at 3:45 p.m. Indian Standard Time. Right. So, Sudarshan, yes, it is pretty addictive. That's why it is given under medical supervision only. Right. Otherwise, it is pretty much addictive. Okay. Thank you, Ritik. Thanks a lot. And a very all the best to all of you for your upcoming examinations. May you all do well. And there is a link given over there in the description in case you want to fill up your information and get some help for your upcoming NEET examinations. Please do that. All right, Nisha, thank you. Bye bye, everyone. See you next time, Monday, 3:45 p.m. Indian Standard Time. Bye, everyone.